Hey everyone, so it's Michael again here, and we are on the prevention of infection section of our home care, home health aid training online program. So let's talk about prevention of infections. But before getting started, let's look at a couple of definitions. We have infection prevention, microorganisms, pathogens, and the chain of infection. So infection prevention is the set of methods used to prevent and control the spread of disease. Microorganisms, on the other hand, are those tiny living things that is not visible to the eye without a microscope. You'll be surprised how you have so many microorganisms living on you at this moment. Especially your nails, your hands, if you're not washing it correctly. Even if you try to be really good and stringent on washing your hands, there are still chances of microorganisms still left in the area. Now you have pathogens, on the other hand, which are microorganisms that are capable of causing infection and diseases. Remember, not all microorganisms out there actually causes diseases. Okay, there are more microorganisms that are good for you than that are bad. But the pathogens are those microorganisms that are capable of causing infection and disease. Now, a chain of infection is a way of describing how disease is transmitted from one being to the other. And right here, for example, is the chain of infection. Number one is the causative agent. What is that pathogen that caused it? The reservoir, the portal exit, the mode of transmission, the portal of entry, and the susceptible host. This chain of infection is what is going to cause the chances of somebody actually getting an infection. So let's think about this main question. Can you think of an example of each link in the chain of infection? Can you think of it? Like, let's talk about the causative agent. Is it a bacteria? Is it a virus? Okay, the susceptible host. Is it a pediatric child, or is it a senior citizen who their immune system is down? Is it an HIV client? Okay. So remember, if one of these links in the chain of infection is broken, then the spread of infection is stopped. So if we can stop one of these things, then there's no infection. So if we don't have a susceptible host, then nobody's going to get an infection. If there is no mode of transportation, then there's no infection. If there's no open area where the entry happens, then of course there's no infection. So let's go ahead and talk about microorganisms and non-pathogenic microorganisms. So the microorganisms are those single-celled organisms that can be only viewed with the aid of a microscope. So some of the types of microorganisms are bacteria, viruses, fungi, protozoa, or helminths. Okay, most microorganisms are harmless, like I said earlier. Some are even beneficials. I want you guys to think about microorganisms that we use to create things, like food, for example. One good way to think about it is, how are we making alcohol, liquor? How have we created cheese? How have we created, so many different food? And remember, there's also a lot of good bacteria at the same time that helps us with our digestion as well. So non-pathogenic microorganisms compared to pathogenic microorganisms, what are they? They are microorganisms that is incapable of actually causing, or actually cannot cause, any infection or disease. So let's talk about some of the pathogenic microorganisms. Bacteria. We hear that a lot, right? Bacteria. So bacteria are those single-celled microorganisms that lack a nuclei, okay, and organized cell structures. A nuclei is like the brain, for example, of that particular microorganism. Now, moving on, viruses are another type. Viruses are small packages of DNA and RNA. Sometimes they actually hit that boundary of, are they a living thing or a non-living thing, right? They actually need a host in order to be able to produce. So they can't just live on their own. They have to attach themselves to something, to a host, to that sick person, or another, for example, another microorganism. Whatever they need to do, that's how they're going to be able to survive. Fungi or fungus, we know what those are, right? We've seen them before. We love fungus. If you like mushrooms, that's one type of a fungus or a fungi. The truffles, that's another type. But then also there's the yucky type of fungus, the yeasts and the molds, for example. Or you have if you have that smelly feet, for example. You can have fungus in your feet as well, fungus in your nails, if you guys didn't know that as well. So there are good fungus and bad fungus. There's good bacterias, and then there's, well, all bacteria are actually bad, but there's good and bad microorganisms out there. Now, let's talk about parasites. Parasites are that organism that lives in or on an organism of a different species or host. Now, the infection actually occurs when those microorganisms, right, when they find a mode of entry, right? So when they enter a susceptible host, right, and then they multiply within that tissue, causing damage to that tissue. So some of the symptoms that may happen if somebody gets an infection is reddened area, swollen area. You may have purulent discharges that's also occurring if there's an infection. Okay, now disease occurs when tissue damages due to the entry and that multiplication of those infection of those more microorganisms results in a clinical sign, those symptoms and those recognizable processes. The host is an organism or a cell. So it could be you or it could be one of the cells that's in your body, okay? And that is where the microorganism will live or it feeds. So let's talk about several of these things. Occupational Safety and Health Administration, or also known as OSHA, or the CDC, and isolation or isolate. So OSHA is that federal government agency that makes rules to protect workers from hazards in the job. So you would have those OSHA binders in your workplace where you're working that should be telling you what type of chemicals are you going to be exposed of in your particular line of work. The CDC, on the other hand, is a government agency, and what it is, it's under the Department of Health and Human Services. Okay, and they issue issue information to protect the health of individuals and communities. So when you see, these guys talking in saying that, that they need to create an isolation. So one best way to look at it in recent events is the Ebola, the spreading of Ebola in the United States, where we actually had a couple cases in here. The CDC is in charge to be able to try to prevent the spread of this throughout the United States. So isolate, what that means is to keep something separate or to keep it by itself and prevent other people to be exposed to it. So when we're working with a lot of clients, whether it's at home or it's actually a nursing home or a hospital, we need to look at the different kinds of standards of precaution. So, a standard precaution is a method of infection prevention in which all blood, body fluids, non-intact skin, and mucous membranes are treated as if they were infected with an infectious disease. Okay, so best way for standard precaution, washing your hands, wearing gloves. Now, sharps, when you hear this, are anything that is, that can cause an injury. Something sharp object, especially a needle. So working with some clients at home, they may have needles because they may be a diabetic patient that they frequently take their blood sugar or they give themselves insulin shots. So we want to be able to make sure that we watch out for this and we protect ourselves from possible injuries because of the sharps. So remember the term body fluids. When we hear body fluids, it's not just your tears, it's not just your saliva, it's your sputum, it's your urine, it's your feces, it's your semen, it's your vaginal secretion, pus or other wound drainage, as well as vomit. Okay? One thing it does not include is sweat. So why should standard precautions be followed in every single client in your care? Well, guaranteed you may be coming in contact with some type of bodily fluids at some time, at some point when you're caring for someone. So you have to make sure that you have standards of precaution. You're protecting yourself, but you're also protecting the person you're caring for. So let's look at some of the practicing standards of precautions, which is washing your hands, wearing gloves, remove gloves immediately when finished with a procedure, don't cross-contaminate, immediate wash skin surfaces, wear a gown, wear a mask, and goggles. That's if there's any chance of you being exposed to any bodily fluids. So, guidelines for practicing standard precautions continue on. You want to wear those gloves when handling sharp objects. Do not handle needles or syringes. Okay? Avoid nicks and cuts. Bag all contaminated supplies. Clearly label body fluids. And dispose of contaminated waste products. So, hand hygiene. Do you guys know what this means? I sure hope you know what this means, of course. It's washing your hands with either plain or antiseptic soap and water or using alcohol-based hand rubs. So, why should hand rubs not be substitute for washing hands with soap or water? The reason for that is there's nothing better than cleaning your hands by washing it, okay? So you're using those hand rub substitutes. Those are typically used in between hand washing, and also depends on what's available. Of course, it's better do something or nothing, but definitely you have to wash your hands would be the best way to actually do things. So let's look at a couple situations when home health aides or home care aides or homemakers should wash their hands. When you arrive at a client's home, when visibly soiled, okay? When the client accidentally urinated themselves or actually, defecated themselves. Before and after touching the client, before putting on gloves and after removing gloves, okay? After contact with any body fluids, any mucous membranes, any non-intact skin or even dressing, after handling contaminated items as well, and before and after making meals or working in the kitchen. Also, before and after feeding a client, before getting clean linens, before reaching into clean area of supply bag, touching garbage or trash, after picking up anything from the floor, before and after eating, before and after using the toilet. Continue on. After you blew your nose, if you smoke after that, after touching areas in the body, before and after applying makeup, after any contact with pets and pet care items, before leaving the client's home. Okay, you need to be able to make sure you wash your hands. Hand washing is the most important thing you can do to prevent the spread of any disease. So, washing hands, we just got to go over these things on how to be able to step by step doing things right. So, number one, make sure you read that. Turn on the water at sink. Keep your clothes dry because moisture does what? It breeds bacteria. You want to be able to then wet your hands and your wrists thoroughly. Not just your hands, guys, okay? You want to be able to apply the soap to your hands. You want to be able to then next keep your hands lower than your elbows and your fingertips down, okay? The reason why you want your fingertips down is because you actually have gravity going for you. So you want to rub your hands together and fingers between each other to create that wonderful lather. Okay, lather all the surfaces of your wrists, the fingers, and the hands. You want to be able to use friction at a minimum of 20 seconds. You have to understand friction generates heat and at the same time helps with the cleaning of your hands. Next thing, clean your nails by rubbing them in the palm of the other hand. Okay, so I want you to imagine that. After that, being careful not to touch the sink, rinse thoroughly under the running water. Rinse all surfaces of your hands and wrist. Run water down from wrist to your fingertips, okay, using your gravity, okay, because what's happening is you want the dirty lather to leave downwards. You're gonna make something travel from the wrist all the way to the fingertips and to the sink. Never ever run water over unwashed arms down to clean hands, okay? Because what's going to happen is if you go ahead and put the water on the area that you never washed, there's bacteria there and it's going to drip it down to your hands, and then guess what? You're bringing in bacteria to your hands. 7, use a clean dry paper towel to dry all surfaces of your hands, wrists, and fingers. Never wipe towel on unwashed forearms and then wipe your clean hands. Dispose of the towel without touching the wastebasket. If your hands touch the sink or wastebasket, you have to start all over again. Next, use a clean dry paper towel to turn off the faucet. Do not contaminate your hands by touching the surface of the sink or the faucet right after you wash your hands. It defies the purpose. 9th, dispose of any used paper towel in the wastebasket immediately after shutting off the faucet. So that is the basic steps. All right, moving on. Let's define some of these followings as we will be seeing these particular terms as we go through the next few chapters. So personal protective equipment, PPE, all right? Those are those equipments that help protect employees from serious injuries or illnesses. Those are your gloves, your gowns, your masks, and did I say gloves? Gloves again, sure, why not? When you hear the term DOF, D-O-F-F, or D-O-N, DON, let's talk about DOF first. It means to remove, to doff your gloves, to remove your gloves. To don gloves, it's to put them on. Okay. Now, I want you to know these points about gowns. Okay, they protect exposed skins, they prevent soiling of clothing, and they should fully cover the torso, and the sleeves should always fit snugly. Now, if we're putting on gowns or when we're donning on a gown, you want to wash your hands first. You want to open the gown, hold it out in front of you and allow the gown to open and unfold, never shaking it. Facing the back opening of the gown, place your arms through each sleeves. You want to then fasten the neck opening, and then reaching behind you, pull the gown until it completely covers your clothing. Secure the gown at the waist. Now, I want you to use the gown only once, and then remove and discard it. Never use it twice. If the gown becomes wet or soiled during care, remove it. Check your clothing and put on a new gown. OSHA standards requires non-permeable gowns, gowns that liquids cannot penetrate when working in a bloody situation. Always make sure you put on your gloves after putting on the gown, not before. The cuffs of the gloves should always overlap the cuffs of the gown itself. So make sure you know that. Moving on, we're talking to talk about masks and goggles. Masks are worn when the client has a respiratory illness or infection. The mask should fully cover your nose and your mouth. Your mask should fit snugly over nose and mouth. Change masks between clients, okay? Goggles, on the other hand, should fit snugly over your eyes or eyeglasses. Let's moving on to putting on masks and goggles. You want to wash your hands. Put a mask by the top string or the elastic strap. Never touch the mask where it touches your face. You want to adjust the mask over your nose and your mouth. Pull elastic strap over your head, or if mask has a string, tie top string first, then bottom string. Do not ever wear a mask hanging from only the bottom tie or strap. What you do next is, if it has the metal strip on the top, pinch the metal strip at the top of the mask. If part of the mask tightly around your nose so that it feels snug. Now put on the goggles over your eyes or eyeglasses. Use the headband to secure them to your head. Make sure they are on snugly. Number 6, put on gloves after putting on the mask and the goggles. So next thing is face shields. You are going to have face shields at time. Can be worn as a substitute for a mask and goggles. Should cover your forehead always and should go below the chin and wrap around the sides of the face. Okay? So let's talk about these couple terms: perineal care and biodegradable. Perineal care, care of the genitals and the anal area. Okay? Biodegradable is capable of breaking down or being decomposed by bacterial or other living organisms. So I want you to know about these things, about gloves when you're wearing them. If you might touch blood or any blood fluids, you have to wear gloves. During mouth care or care of any mucous membranes. During perineal care, providing personal care or non-intact skin. Providing personal care if aide has cuts on hands. Shaving a client, don't forget that, and disposing of any soiled linens. All right, do not contaminate the room around you by touching objects with dirty, contaminated gloves. Okay, you don't want to spread the germs. You want to prevent it from spreading. All right, so when we're donning on gloves or when we're putting on gloves, yes, wash your hands first. It's a must. Okay, if you are right-handed, slide one glove on your left hand. Reverse if left-handed. Using your gloved hand, slide the other hand into the second glove. Interlace the fingers to a smooth out fold and create comfortable fit. You want to be able to carefully look for any tears, any holes, any discolored spots, and replace the glove if necessary. Now, if you're wearing a gown, remember, pull the cuff off the gloves over the sleeves of the gown. Now, when we're removing gloves, touch only the outside of the glove with one hand. Grasp the other glove at the palm and pull the glove off. With the fingertips of your gloved hand, hold the glove you just removed with your ungloved hand. Slip the two fingers underneath the cuff of the remaining glove at wrist. Do not touch any part of the outside of the glove because that's dirty, and then you're going to get that into your, non-gloved hand or fingers. You want to pull down, turning this glove inside out and over the first glove as you remove it. You should now be holding one glove from its clean inner side and the other glove should be inside it. Drop both gloves into the proper container without contaminating yourself, and then make sure you wash your hands. Now, Understanding the guidelines for cleaning spills involving blood, body fluids, or even glass. And remember, vomit is included in that, okay? You want to be able to make sure you put on gloves. You want to be able to use a proportion of 1/9 bleach to water solution or approved product. For any fabrics, use disinfectants or soaps and water. Okay, make sure you wear gloves again. You want to use tools, never the hands, to pick up the glass. You want to be able to make sure you properly bag any waste. You need to use a biohazard waste bag if needed. And also, you need to dispose of biohazardous waste separately from the regular garbage. All right, 3 more definitions: the transmission-based precautions, droplet precautions, and airborne precautions. Transmission-based precautions are a method of infection prevention used when caring for people who are infected or suspected of being infected with a disease, also called isolation precaution. Droplet precaution, on the other hand, is a special measure used for diseases that are spread by droplets in the air. And how are droplets occurring? Is if somebody sneezes, okay? Next thing is airborne precaution. This is a special measure used for diseases that can be transmitted through the air after being expelled, okay? Contact precaution, on the other hand, is special measures used when a person is at risk of transmitting or contracting a microorganism from touching an infected object or person. Antimicrobial is an agent that destroys, resists, or prevents the development of pathogens. So transmission-based precautions are always used in addition to standard precautions. Remember that, okay? So airborne precautions are used for disease that can be transmitted, spread through the air after being expelled. Airborne pathogens are so small that they can actually attach to moisture in the air and remain floating for some time. Some examples are tuberculosis, measles, chicken pox, okay? So precautions would be face mask, a gown, washing hands, and of course proper ventilation, especially for tuberculosis. Droplet precautions, on the other hand, are spread by coughing, sneezing, laughing, or talking. Yes, just by talking. Some examples would be influenza or mumps. Precautions would be face masks, covering your nose and mouth when sneezing or coughing, and even especially washing hands. So contact diseases next. Contact precautions would be, where they normally occur with skin-to-skin contact during transfers or bathing. Examples would be conjunctivitis or pink eye, C. diff, lice, or even scabies. Precautions will be using personal protective equipments. You want to be able to make sure you wash your hands using disposable equipment when possible, not touching infected surfaces with gloves, not touching uninfected surfaces with contaminated gloves, not sharing towels, linens, or even clothing. Now, I want you to know these following guidelines for any isolation procedures. You want to be able to make sure wash dishes and utensils in hot water with antibacterial soaps. You want to limit the amount of disposable equipment, okay, of non-disposable equipment. You want to clean and disinfect items before taking them from the home. You want to be able to make sure that 1:9 ratio of bleach and water for spills and contaminated surfaces. You want to be able to make sure that you disinfect and you clean the surfaces often, and make sure you use separate bathroom, okay? So define the following terms: clean and dirty. Do you guys know what that means? I sure hope so. Clean, healthcare, a condition in which an object has not been contaminated with pathogens. Dirty, in healthcare, is a condition in which an object has been contaminated with pathogens. But just because it's dirty doesn't mean you throw it away, because it depends on your facility. So disinfection and sterilization, just pretty much opposites from each other. Disinfection, a measure used to decrease the spread of pathogens and disease by destroying the pathogen. Okay, we're disinfecting it. A sterilization is a method used to decrease the spread of pathogens, okay, and disease by destroying all microorganisms, including those that form spores. So in home care, you may disinfect items used by the client. You may or will also disinfect some areas while doing housekeeping tasks. The care plan and your assignments will specify what disinfection you need to do. So some of the general methods of disinfection are by wet and dry heat and by chemicals. Wet heat disinfection uses boiling water to disinfect. Dry heat disinfection means baking in the oven. So let's talk about disinfecting using wet heat. Some of the equipment that you will be using is items to be disinfected, the clean pot with enough room to hold all the items, a clean lid for the pot, cold water, timer or clock, a stove, and also pot holders. You want to wash your hands. Place items in the pot and fill it with water. Make sure the water covers all the items. Place the lid on the pot and place covered pot on burner or the stove. What you're really doing here is you are actually boiling whatever you need to clean. So if you had kids before, you know somebody who has kids and you actually seen them actually boil, the kids bottles and everything, that's them actually sterilizing that, okay? You're using a wet heat, okay? So you want to be able to use that to disinfect a little. Once the items have cooled, you want to remove the cover with the pot holders. You remove the items, place on a rack or a clean towel to air dry. You'll be able to make sure wash and dry the disinfecting equipment, return to the proper storage, wash your hands, and you always want to document any procedures you do for the client. So using dry heat, this will be the steps that you need to do. Now, blood-borne pathogens. Blood-borne pathogens are those microorganisms found in human blood that can cause infection and disease. So now it's blood-borne. It lives in the blood, okay? So you want to be able to understand the diseases that are transmitted, okay? So you have infected blood, infected semen or vaginal secretion, sexual contact, needle sharing, infected mothers, contact in healthcare setting. Okay, so these are ways that you're going to be able to transfer this sometimes. So you want to be able to remember that you can safely touch and spend time with clients who have a blood-borne disease. You can say that also, but these clients need the same thoughtful, personal attention you give to all your clients. You have to be able to make sure you follow the standard of precautions, but never isolate a client emotionally because he or she has a blood-borne disease. Just because that they have an infection, that does not mean that you treat them differently from any of your clients. Okay, so let's talk about OSHA's blood-borne pathogen standard. The blood-borne pathogen standards is a law that requires healthcare facilities to protect employees from blood-borne health hazards. By law, employers must follow these rules to reduce or eliminate the risk of exposure to infectious disease. The standard also guides employers and employees to the steps to follow if exposed to infectious materials. So let's talk about some blood-borne diseases. So you have your HIV and your AIDS. HIV meaning human immunodeficiency virus, a virus that attacks the body's immune system and gradually disables it, eventually causes AIDS. Now, AIDS, on the other hand, is the final stage of HIV infection in which infections, tumors, and central nervous system symptoms appear due to a weakened immune system that is unable to fight infection. So just because you have HIV, that doesn't mean you have AIDS, okay? It's a big difference. So with HIV, there's a lot of healthy people out there that has the virus but is living fine. You have like Magic Johnson, for example, is a good example. So moving on is hepatitis and jaundice. What's hepatitis? It's the inflammation of the liver caused by certain viruses and other factors such as alcohol abuse, some medications, and even trauma. Now jaundice, on the other hand, is that condition in which the skin, whites of the eyes, and mucous membranes appear yellow. So what are the three most common types of hepatitis? That's A, B, and C. That's easy enough, right? Hepatitis A results from fecal to oral contamination. Hepatitis B is transmitted through contaminated blood or needles or by sexual contact with an infected person. Hepatitis C is transmitted through blood and possibly sexual intercourse as well. So remember, the hepatitis B vaccine is usually given as a series of 3 shots. Prevention is the best option for dealing with this disease. Take the vaccine when it is offered, okay? So let's understand the following high-risk behaviors that can cause problems of getting some blood-borne infections. You have your sharing of needles for drug users, unprotected sex, sexual contact with multiple partners, exchange of body fluids with infected partners. Just like when you can actually spread this if you're kissing somebody who has, infection in their bodily fluids. So let's talk about remembering the precautions against HIV or AIDS, just like the other slide. Never share needles, practice safe sex, stay in a monogamous relationship with uninfected partner, practice abstinence, get tested, and follow standards and precautions. Very good ways to kind of prevent the spread of this. So the right to confidentiality is especially important to people with HIV and AIDS. Remember that, okay? Others may pass judgment on people with this disease. A person with HIV or AIDS cannot be fired from a job because of the disease. However, A healthcare worker with HIV or AIDS may be reassigned to job duties with a lower risk of transmitting a disease. HIV testing requires consent. HIV test results are confidential and cannot be shared with a person's family, friends, or employer without his or her consent. So, depending on the community, many resources and services may be available for people with HIV or AIDS, including the following: there's counseling, there's meal services, there's access to experimental drugs, and also social workers. So, moving on to infection prevention, let's talk about these three: tuberculosis, latent TB, and active TB. So, TB is a highly contagious lung disease caused by a bacterium that is carried on mucus droplets suspended in the air. Latent TB is a type of tuberculosis in which the person carries the disease but does not show any symptoms and cannot infect others. Active TB is a type of TB in which the person shows symptoms of the disease and can spread TB to others, also known as TB disease. Now, multi-drug resistant TBs is a type of TB that can develop when a person with active TB does not take all the prescribed medications. Remember, we teach people that we need to be able to take the full dose to prevent any resistance or any bacteria to start having resistance to something. The term resistant means the state in which drugs no longer work to kill the specific bacteria. Phlegm is that thick mucus from the respiratory passages. So here are some of the signs and symptoms of TB: fatigue, loss of appetite, weight loss, slight fever and chills, and of course night sweats as well. Other symptoms would include prolonged coughing, coughing up blood, chest pain, shortness of breath, and difficulty breathing. All right, let's look at some of the guidelines when we're dealing with tuberculosis. You want to follow the standards of precaution and airborne precautions as well. Wear the mask and gown, handle sputum or phlegm carefully, ensure proper ventilation, follow isolation procedures if ordered, assist with the medications. Now remember that if you think you may have been exposed to TB, HIV, AIDS, or any hepatitis at work, report this to your supervisor immediately. Follow out an incident report or a special exposure report form. Your employer will help you find out if you have been infected and take the steps to prevent you from becoming sick. So why is reporting a possible exposure to an airborne or bloodborne disease so important? Well, you need to be able to report things like that because you want to be able to limit the risk of exposure for other people as well. And you need to find out if you were actually exposed or not. So moving on, we have the multi-drug resistant organisms, methicillin-resistant Staphylococcus aureus, and VRE. So VRE and MRSA or MRSA is something that falls under the categories of MDROs. So multi-drug resistance, microorganisms, mostly bacteria, that are resistant to one or more antimicrobial agent that are commonly used for treatment. MRSA is an infection caused by a specific bacteria that has become resistant to many antibiotics. VRE, on the other hand, is a bacteria that have developed resistance to antibiotics as a result of being exposed to vancomycin. C. diff, on the other hand, is a bacterial illness that can cause diarrhea and colitis, spread by spores in the feces that are difficult to kill. So, know the two types of MRSAs: hospital-associated or community-associated. So, hospital-associated, we got it from the hospital. Community, we got it from the community. So, it is spread through direct or indirect contact. Now, hand washing is honestly the single most important measure to control the spread of MRSA. So moving on to VRE, also can be spread either direct or indirect. So another best way to prevent VRE, of course, is hand washing. Congratulations, you guessed it right. Hand washing prevents a lot of different things. Now for C. diff, they're spread by spores, okay? It's an intestinal flora altered due to your enemas, nasogastric tubes, GI tract surgery, and overuse of antibiotics. Okay, so because of overusing antibiotics, we actually killed some of the good bacteria in our stomach that actually helps kill these intestinal floras. And so once we have this, it's hard to get rid of, okay, and it causes diarrhea. Now, once again, proper hand washing and handling of waste can prevent the C. diff from happening. Your hand sanitizers are not effective fully in this case. Soap and water is a must to be used each time hand hygiene is performed. Okay? You want to make sure you disinfect the surfaces and limiting antibiotic use can also help. Now, what are your employer's responsibility for infection prevention? Okay, their responsibility is to establish procedures and policies and exposure control plans, provide in-service education to the staff, all right, provide proper protective equipments, and provide HBV vaccination as well. Now, other responsibilities is following standard precautions, following those policies and procedures, follow care plan and assignments, take advantage of HPV vaccines, report any exposure immediately, and participate in any in-service education. Those are responsibilities of you or your fellow employees. That has concluded our infectious disease section of our training, and we hope that you actually continue on and keep on watching the videos. There is going to be an examination that's going to be post after this. Pretty much post means after this particular presentation. We wish you good luck for that, and if there's anything that you guys have questions on, please don't hesitate to email us as soon as you have that question.